Hello and welcome to the Imprint Weekly Podcast. I'm John Kelly, senior editor of the Imprint, a daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at the Imprint News. You can sign up on our homepage for our free weekly and monthly newsletters. And for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business, policy, and practice. The Imprint Weekly Podcast is also a member of the SafeCamp Audio Network. You can check out our show page and all of SafeCamp's other great podcasts at safecampaudio.org on the web, at SafeCamp Audio on social media. This is going to be headlines week for February on the Imprint Weekly Podcast, and I am going to keep it short today. I was off on vacation a little bit of last week and this week, and now I'm kind of fighting off the cold and flu thing that everybody I know has already gotten around here in the Midwest. It is cold every day. Before I get into the headlines that I want to call out today, I did want to welcome to the Imprint family our newest rescue dog, Bear, who was just recently adopted by Christina Anjoko, who is the wizardess of this podcast. She makes everything sound nice and mixes it all together once I'm done yakking. So if you see the lead art for this episode, which is always going to be on the Imprint homepage when we put up a podcast, you will see a picture of Bear. He is really cute and huge. All right, so on with the headlines. In 2018, Congress passed and President Trump in his first term signed the Family First Prevention Services Act into law, and it did a few things as it relates to federal funding. One of those was to expand the scope of the Title IV-E entitlement, which used to mostly pay for foster care and adoption costs and administration costs for states related to those two things. And it included sort of an expansion of that to include prevention services. And I would define that further to say that prevention services in this context of Family First meant services aimed at preventing a child who was already a CPS involved from entering foster care. And there were kind of three buckets of services that were going to be reviewed by this Family First Clearinghouse, which does continue to exist today, in those three buckets that I mentioned, which are parenting, substance abuse, and mental health services. And the idea was the clearinghouse reviews you, awards you a certain level of evidence, promising, supported, or well supported. If you get one of those three, you're on the list, and states can draw down money to use those services. If you don't meet the criteria, you got to keep trying and bringing back more evidence. So that was passed in 2018. Most states at this point have put together a list of programs off the clearinghouse sort of menu of approved programs and models to gain approval from the feds to start drawing down money. But there's, I'd say, just almost, universal frustration in the amount of uptake so far. Family First Prevention Services represents a very, very tiny piece of the federal dollars that are going out. And that is because while states have gotten their approval from the feds for their state plans, they haven't really started in most cases in most states to draw down on that. So there's been a lot of wanting for the clearinghouse to move faster, for people to start maybe thinking outside the box on how to include more services more quickly that states might take advantage of. I personally don't think that's like in and of itself the only sticking point here, but that certainly is something people are wanting. And the story that I'm about to kind of relay is in the lane of substance abuse as it applies to that. So in mid-December, the Trump administration announced that it was creating a fast-track process within the Family First Clearinghouse for what is referred to as medication-assisted treatment programs. A lot of people just call those MATs, M-A-T. And that approval, that fast-track process was for drugs that had already received approval from the Food and Drug Administration. And so the three MATs in particular, that in December they announced they were going to use this fast track approval process to review were buprenorphine, naltrexone, and methadone maintenance therapy. And I'd add that methadone maintenance therapy had already made it onto the clearinghouse, but only as a promising practice. Earlier this month, that first fast track announcement led to some official approval of all three drugs. The administration announced, both at a press event as well as in an op-ed to the Imprint, that it would be providing the highest tier of approval, which is well supported, to these three drugs, which again were buprenorphine, naltrexone, and methadone maintenance therapy. I'm going to link to our coverage of this decision and the announcement, as well as the op ed that the Administration for Children and Families wrote that we published. Here's just part of what they had to say in our pages, though. And I'm quoting from that op ed. Evidence standards are rigorous by design, and rightly so, but the process for clearing services has often been slow, resource intensive, and mismatched with urgent community needs. In practice, that has meant that some of the most effective tools for addressing root causes of foster care entry, particularly parental substance abuse, have remained out of reach. At the Administration for Children and Families, we believe prevention should be real, usable, and impactful, not theoretical. That is why we are cutting red tape, accelerating access to evidence based services, and rolling out the welcome mat for states ready to act. So, again, look to the show notes to read up on what reporters Michael Fitzgerald and Sarah Tiano explained and reported on as far as this goes, and as well as the op ed that we published. You can find those both in there. Just kind of two additional things from me on this. First, on a more macro level, it's going to be interesting to see if this is the only idea that the administration has for incorporating things into the clearinghouse by inference from another respectable source. Here we are talking about the FDA, and there are certainly other drugs through that have gotten FDA approval that you might see them start to add onto this list and review. One reader pointed out to me that there's a way that could be used for mental health related drugs just as easily as these MAT treatments. But there are other potential approval sources that might get pulled in here. And I think that's what I'll have my eye on. I believe there was at one point during the first Trump term, kind of buried in one of their budget documents, like what they were requesting from Congress, the idea that the California Evidence Based Clearinghouse, which has been doing kind of similar work in reviewing social service programs, actually long before the Family First Clearinghouse started to do it. I think the idea that was kind of proffered in their budget documents was that everything that was in the California Evidence-Based Clearinghouse would just sort of be inferenced in to the Family First Prevention Services Clearinghouse. And I don't think that, obviously, that didn't go anywhere because that did not happen. Well, there are other clearinghouses and lists of approved programs that, you could be incorporated in if you wanted to go that route. California Clearinghouse is one. I don't know if the word California is so taboo with the administration now that might not be on the table. There's a home visiting clearinghouse that already exists within the government. I'm sure there's a lot of other ones that somebody smarter than me could come up with that might be helpful if they were trying to kind of expand the scope of what they more rapidly wanted to stand behind as saying these are viable things to use $40 on. Now, more specific to this announcement, it certainly can be viewed as an acknowledgement that the administration sees treating parental substance use as a key to their overarching goal that we have talked about on this podcast before of a home for every child, right? They want there to be, by the end of this Trump term, a 1-to-1 ratio of licensed or available foster homes to children in foster care. And sort of the reason that became the North Stars, in the words of Alex Adams, who's the Assistant Secretary for Family Support for the Trump administration, on this podcast, he talked with Michael Fitzgerald, my colleague, and said, the nice thing about that North Star is you can kind of mess with both variables. You could work really hard to raise the number of foster homes available. You could work to lower the number of kids that you have in foster care, or you can kind of work at both at the same time. So certainly on the side of how can we work to lower the number of kids who come into foster care, there's certainly no question that even as the number of kids in care has declined year over year for a long time now, really since like 2017 or 2018, parental substance use remains one of the primary drivers of cases where removals are deemed necessary. So certainly when you talk about how do you lower the numerator or whatever, the number of kids in denominator, I guess, depending on how you build a ratio, that certainly is a plausible strategy. But there are some serious limits on how many caregivers or parents and their kids would actually gain a direct benefit from these drugs, these MAT drugs, being available through the Family First Prevention Services Act. And that's because Medicaid and private insurance are already by law required to cover these drugs. And when Family First was passed, and it was a late addition to the bill, there was an addition that basically said that Title 4E has to be what's referred to as a payer of last resort behind Medicaid and anything else, which is just a kind of fancy way of saying if Medicaid will pay for it, you can't pay for it with Title 4E. Now, there actually is a kind of a way to do it. You are allowed to spend your 4E dollars on things that Medicaid would pay for, as long as you are then going back and backfilling into it through Medicaid. I'm assuming, even as I just say that out loud, it's pretty complicated and involves a lot of paperwork. There is a way to do that. But generally, the rule is that if Medicaid or a private insurer would pay for it, you can't really tap into 4E to spend on it. So the group that could benefit directly here are those parents who are uninsured, right? That's what we're looking at, is the parents who have open CPS cases, are facing, a potential removal of their kids, and are not currently insured through Medicaid, through private insurance, through anywhere. I sort of asked around a little bit last week for some intel on sort of what the size of that group might be. And, hat tip to Emily Putnam Hornstein of the University of North Carolina, Chapel Hill. She gave me some numbers here. So let me just run these down because she did find a few for me. The first two come from the self-reporting in what's called the National Survey on Child and Adolescent Well-Being, or in the sort of wonky world of child welfare research, NSCAW. So you sent me the numbers from NSCAW 2, which happened in the early 2010s, and then NSCAW 3, which happened more recently in the 2020s. In that first one from the 2010s, there were 30% of CPS involved parents who reported being completely uninsured, no Medicaid, no private, nothing. 30%. In the second one, the more recent one, NSCAW 3, that number had dropped to 13.3%, which really speaks pretty clearly to the impact of the Affordable Care Act. And a healthy portion of that closure of that gap, right, between 30% down to 13.3%, it's likely accomplished by Medicaid in part, but also by private insurance and the Affordable Care Act market, who would all be required to cover MAT treatment, Medicaid, and these private insurers. Just some other data directly from a few states really shows specifically on the Medicaid coverage that there's certainly some variance. So Florida and California, there's some pretty good available data on. They're both in the 60% range. So of CPS involved parents in California, about 62% are enrolled in Medicaid. Florida, it's about 68%. Compare that with Kentucky, where it's very high. It looks like about 85% of parents who are involved in CPS cases are receiving Medicaid. So I think it's going to be a case where there's going to be certain states where there's actually a lot of uninsured adults and parents and caregivers who this might be a big boon to the state if they could build that infrastructure up to service more families with MAT treatment and the surrounding supports that you need to give somebody. Because again, just giving somebody methadone maintenance therapy, I mean, it's right there in the word, it's not supposed to just be drugs. It's supposed to be a piece of a bigger pie. All right, next headline for this week. There are two big annual child welfare reports that come out of the federal government each year. One is AFCARS, the Adoption of Foster Care Analysis and Reporting System, which covers the kids in foster care, right? The number of them, how many have entered, how many are in care, how many of them exit, demographics related to that. And then there's the Child Maltreatment Report, which covers basically the system leading up to that point of foster care. And each year reports out on the number of reports of suspected maltreatment, how often those reports are screened in for investigations, how often those investigations lead to a confirmation or a substantiation of victimization, of abuse or neglect. And then also the number of abuse and neglect fatalities, though, especially on that metric, pretty much everybody agrees that this report, the Child Maltreatment Report, has an undercount of the number of deaths. I will drop a link to our summary of the report and the report itself in the show notes. But bottom line here is that we see mostly in 2024 a continuing of trends in what these numbers say about the way that the system is flowing. The general pattern, with a brief pause during COVID, has been that the reports of suspected maltreatment have been going up and up and up, while the number of those reports that lead to investigations when confirmed victims of abuse and neglect have gone down. The 2024 numbers actually show that reports have plateaued and maybe even dropped a little bit. They were at 4,378,000 in 2019, right before COVID. Now they are at 4,365,000, which was not even a 1% decrease, but it is like, a slight decrease. Meanwhile, the number of kids who receive either an investigation or some kind of differential response, that number is down 17% since 2019, so right before COVID again. And then the number of confirmed victims of abuse or neglect, that's down 19% in the same time frame. The number of fatalities, like I said, pretty much everybody agrees is probably an undercount, shows that, in 2024, the number was down a couple hundred since a recent peak of 2,032 in 2022. The fatality rate for Black children, though, is up a lot in this decade. So in 2024, that rate, which is expressed as per 100,000, was 6.11 per 100,000. That is up 21% since 2019, right before COVID. And then if you go back a decade to 2014, that rate is up 42%. And this is the first year in that time span, in this last 10 years of data, in which Black children accounted for the highest number of fatalities of any race. There were 548 documented fatalities among Black children. Compare that with second, which would have been white children with 516. Again, check the show notes for the full report and for our summary of it. All right, like I said, keeping it quick, just a couple of other headlines I wanted to flag for folks. We discussed the situation in Georgia a bit on the podcast, I think at the end of last year, maybe a little bit in January as well. As the federal government shutdown ended in November, the state's Division of Family and Children's Services, which is just usually known as DFACS in Georgia, started to kind of gatekeep child welfare services at the state level. So really, like, all these things that used to just sort of pro forma happen in terms of approving services for kids that needed them or parents that needed them, some of that stuff started to get kicked up to the state office for approval. And if you didn't get their approval, you couldn't spend on it. That was kind of paired with some cancellations and cuts to contracts with some of the state's veteran private providers, which kind of got all of this in front of the legislature for hearings. And that is where we learned that there was an $80 million budget deficit that the director of DFACS, Candace Brose, has attributed to a variety of things, including the complex needs of kids in her care, her agency being asked to handle youth who are not really specifically in their purview, foster home shortages, and a few other things. Now, the latest development here is that the House, the Georgia House, has approved enough new money to fully account for the deficit, but both chambers of the legislature there want some kind of audit or look at, oversight aimed at, isolating the root causes of how the agency got here to the point where they were running such a large deficit that they had to start gatekeeping services and canceling contracts. So language in the Senate side on Georgia to set up a committee to study all this cites that the cost of foster care has gone up 160% since 2022 in Georgia. That is a lot. So the story, which I'll drop a link in the show notes for you if you want to read up on it. I think that obviously this is of interest to Georgia readers. I continue to think that they're kind of a canary in the coal mine here. I think there's some things that are unique to Georgia and the way they pay for child welfare that have probably got them into this situation. But I think some of the fundamentals at play here are things we are going to see either in this legislative and budgeting season or the next one, as you just have these states that are dealing with overall inflation costs, right? I have seen and talked to people in, for example, Ohio, who have seen the cost of their foster care kind of skyrocket, even though there's not as many kids. And in some counties, way less kids in the system. There's, something that we're reporting on now, which is this kind of dynamic of, are we seeing more kids starting to enter foster care because their parents are seeking to surrender them into it because they cannot access the support that their kid needs at home, right? There's all kinds of factors here that I think, I just don't really buy that Georgia's the only one that's going to go through this. So it's just a watch this space kind of situation. So, not to be all bad news in Georgia, also check out Jordan's piece on some new housing complexes for youth aging out of foster care in the state that focus on trying to strike kind of the right balance between, providing independence for young adults, right? Because we're talking about, young people who are between the ages of 18 and 21 mostly, but also this kind of connective tissue of mentoring and continuing life skills during that time. So I'll drop that in the show notes as well. All right, and the last thing I wanted to kind of cover today are two youth justice stories that on their face really aren't alike, but have a common thread that I think is interesting. And I'll post both of those to our show notes. I know it's the most repetitive thing I say. One is from the Imprint, covers a class action lawsuit over conditions in New York's detention facilities for youth. And the other is a piece from the Lexington Herald Leader in Kentucky about Kentucky Governor Matt Beshear seeking to increase the number of juvenile detention centers in the state. So, one story is about problems in existing centers, another about the perceived need for more centers. And the common denominator here is workforce issues. In the New York lawsuit, shortage of any staff, let alone highly qualified and well trained ones, is cited as a main driver of the situation where many youth are living in full-time solitary confinement in squalid conditions. And I'm just going to read to you from our coverage of this. They sleep in small and stark cells, barren and sometimes windowless, with a single mattress and table on a concrete floor. While in isolation, youth report they do not see teachers. Some have limited access to drinking water and rely on garbage pails, water bottles, food containers, or buckets to relieve themselves when staff can't escort them to a bathroom. The suit against the state's juvenile justice agency claims. And Kate Wood, this is also from our story, she is from Legal Aid, said young people are being subjected not only to isolation as a form of punishment, and this is her quote, but to isolation as a means of operating these facilities with dangerously low staffing levels. Now we move to the Kentucky story. And again, that one is that Beshear wants tens of millions of dollars to pay for two new juvenile detention centers focused on housing girls who are involved in the justice system. Here's the scenario in which he proposes to inject two full new facilities. And I'm reading here from the Lexington Herald Leader. Mandatory overtime is common, leaving employees exhausted and unhappy, managers said. And in some facilities, staff routinely work 12-hour shifts. Jason Little, who runs one of the existing detention centers in Kentucky, was quoted at length in this stories. Here is some of what he had to say. And I'm just going to read the section. Some of this is a quote from him. Some of it is set up from the reporters. Some months in 2025, there were nearly 30 incidents of fighting, assault, or physical restraint by staff inside the Adair County Center, often involving the use of pepper spray by staff, according to the reports. Our current staffing level does not allow freedom of movement, so youth engage in fighting with each other and staff anytime they are out of the cells, Little wrote in a report. Ideally, youth in state custody leave their cells to eat, attend school in a classroom in the building, shower, and get recreation and exercise. However, because of staffing shortages in Adair County, youth spend less time outside their cells, which led to boredom and frustration and ultimately behavior problems, the facility warned in a separate report last May. So you have two different scenarios here where, like I said at the beginning, the common thread here is that, and I don't think that this is just these two states. I think we're in a real situation here where juvenile facilities in particular, but I think this is also probably true both in like the mental health world and in child welfare, are having a very hard time training and keeping people who are qualified to do very hard work to keep young people safe in these secure residential places. it is pretty wild, honestly, for a governor to be seeking to build 2 new detention centers when that is the reality that he's hearing from his managers at the ones that are existing now. And this is not anything, there's nothing new under the sun, right? We went through the Great Resignation. That was, sort of a byproduct of COVID and quiet quitting and everything that was happening at the time. But we're several years out past that now. And, people in the world of human services and corrections, frankly, are kind of voting with their feet away from working at these places. So I think that that's one way to look at this. Is we used to have a huge problem in youth justice with overcrowding. There were just these, if you build it, they will come facilities that were enormous and people filled them with kids. We're not in that space anymore. We've certainly seen a dramatic lowering of the number of kids who are actually, detained or committed to juvenile facilities. But it almost feels like in some of these places, the experience inside the facilities for those who are there are probably just as bad as they were when we had, kids just stacked on top of each other in these juvenile facilities, because they don't have the workers to do anything other than keep kids in their cells alone. And then of course, what's going to happen when you leave kids basically bored with no engagement all day long and get them out for an hour a day, bad stuff is going to happen. So this is I think that this issue, the continuing problem with staffing shortages and quality issues, is something that we'll be paying attention to this year at the Imprint. And if you have any, story leads or thoughts on anything I talked about here, wide open to input from the community. Hit us up at tips at imprintnews.org. That is going to do it for this episode of the Imprint Weekly Podcast, which is a production of the Safe Camp Audio Network, which is a division of Fostering Media Connections. Please visit safecampaudio.org on the web or at safecampaudio on all major social media. This podcast is produced and mixed by Christine Anjoko, with music by Luke Giroux and Cyrus Elliott. If you enjoyed this episode, we would love it if you would consider subscribing or giving us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. And we would greatly appreciate if you would consider supporting our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow to cover more great stories in child welfare and youth justice. To support us, it is very easy. Just visit imprintnews.org/donate. You can follow The Imprint on Twitter and Facebook by searching the handle @TheImprintNews, and visit us on the web at imprintnews.org. You can always get us over email at tips@imprintnews.org. I'm John Kelly, and we'll see you next week.